All right, welcome everyone, and thank you for joining today's webinar on the Prevalence Reduction Innovation Forum results from the field. I am Dr. Lydia Aletraris. I'm the Associate Director at the Center on Human Trafficking Research and Outreach at the University of Georgia and the coordinator of the Prevalence Reduction Innovation Forum. I will be your host for today's session. Our agenda today includes opening remarks by our esteemed guests, a presentation by the University of Georgia on our overall findings and future directions, brief presentations by the 7 research teams, a Q&A session, and closing remarks before we wrap up at 11:30 a.m. Eastern Time. We'll also include a 50-minute break from 9:45 to 10. As we move through today's presentations, I encourage you to submit your questions using the Q&A box below, because we will have a dedicated Q&A time towards the end of the webinar where we'll be addressing as many of your questions as we can. Now let's jump into the content that we have lined up for today's session. Thank you again for being here from all over the world. First up, please welcome the Director of the Center on Human Trafficking Research and Outreach at the University of Georgia and of the Prevalence Reduction Innovation Forum, Dr. David Okech. Dr. Okech, over to you.
Good morning, everybody, and good afternoon, good evening from wherever you are. It is my pleasure to be here again to see you. I can see many familiar faces and also a few new names that I can see here. But what a pleasure this has been. This has been a great journey, just going through this process over the last 3 years. So without further ado, we are going to hear more, but it is my pleasure to introduce our provost. I also want to take this opportunity to acknowledge some of our guests and some of our special guests that we have here. Ambassador Cindy Dyer, and Ambassador Dyer actually made a very, very strong speech during our ECOWAS conference earlier this year. So I really want to recognize her support for our work. So it's my pleasure now to introduce our provost, Dr. S. Jaku, who is a Senior Vice President for Academic Affairs and Provost of the University of Georgia. In this role, he oversees instruction, research, public service, and outreach and information technology at the University of Georgia. Prior to his appointment at UGA, Provost 2 was Vice President for Research at the University of Michigan. His research in manufacturing systems, assembly, and engineering statistics has been supported by more than $46 million in external funding from agencies such as the US Department of Energy and the National Science Foundation, as well as corporations such as General Motors. Provost who has authored or co-authored nearly 200 peer-reviewed journal articles, as well as several book chapters, government and industrial reports. He holds 8 patents, co-founded a startup company based on his research, and worked closely with several industry partners to enhance manufacturing quality and productivity. Who has developed and taught courses in design, manufacturing, and engineering statistics. Who is a member of the National Academy of Engineering and serves as a member of the Executive Committee of the National Academy's Transportation Research Board. He is a fellow of the American Society of Mechanical Engineers, the Society of Manufacturing Engineers, and the International Academy for Production Engineering. Who is a UGA Foundation Distinguished Professor in the School of Environmental, Civil, Agricultural, and Mechanical Engineering in the UGA College of Engineering. He earned his PhD in Mechanical Engineering from the University of Michigan. Provost who has been a great support actually of our work here at CenHTRO and provided me with lots of wisdom in establishing the center. As a mechanical engineer, he appreciates the systems approach that CenHTRO uses in addressing human trafficking across Africa. I regard Jack as a great mentor. Over to you, Provost Hu.
Thank you so much for the introduction, David. Good morning, everyone. On behalf of the University of Georgia, its faculty, staff, and students, it's my honor to join you in this webinar and welcome you to the Prevalence Reduction Innovation Forum Global Conference. I would like to extend my warm welcome to all of you and to all the research teams who will be presenting their findings today. And thank you for your committee of research and innovation as you test various methodologies and approaches to measuring human trafficking around the world. I also want to welcome Cindy Dyer, U.S. Ambassador at Large, to monitor and combat trafficking in persons. Thank you, Cindy, for joining us today and for your office's generous support to those projects and to the work that we do. The University of Georgia is extremely proud of the work that is being done in the Center on Human Trafficking Research and Outreach. Thanks to Dr. David Okech's leadership, I think the work is making an impact globally already. The center's recent accomplishment included 3 baseline reports on human trafficking in Guinea, Senegal, and Sierra Leone, as well as project on research in combating trafficking in Malawi and Zambia. Those reports help guide anti-trafficking programs and policy advocacy in each of the project countries. The center is also collaborating with 3 United Nations agencies: the International Labour Organization, the International Organization for Migration, and the United Nations Office on Drugs and Crime. Those collaborative projects is an effort to develop operational tools, methodologies, and uniform guidance to measure human trafficking at the local and global scales. Through research, programs, policy, and outreach, CenHTRO is building global partnerships and providing vital information to governments, community groups, and service-providing agencies as they work to reduce human trafficking and other forms of exploitation. Just last month, CenHTRO hosted an open house where attendees were able to learn about those vital research projects and their impacts. As David mentioned, my background is in engineering. As an engineering researcher and educator, I have great appreciation for the importance of creating effective and adaptable data-based approaches to conducting research and solving problems. This is what has been done so well by Prevalence Reduction Innovation Forum. The data that you have generated is geographically targeted and industry-specific. Those data provide much needed insight on what research methods are the most effective in the fight against human trafficking. In addition, CenHTRO recently published the first meta-analysis on human trafficking interventions. This novel study documents the effectiveness of various interventions for survivors and can be used to inform impactful policy. I look forward to seeing how your continued findings will shape human trafficking prevalence estimation and reduction in the future. Thank you all for your commitment and leadership. I wish you all a productive day and a happy holiday season. Thank you.
Thank you very much, Provost Hu, for the commitment and leadership of UGA to this PRIF work and all the other human trafficking work that the team is doing. We are also very excited about the follow-on project that you mentioned. It has been a real pleasure to work with David and Lydia and the rest of the CenHTRO team. I've been impressed at the dedication of the staff and all of the survey research teams and have been excited to see the results of the research be directly and immediately applied to strengthen PEMS-funded programming across the program, across all of the countries through my role as the team lead for the PEMS team, the Program to End Modern Slavery team. So thank you to all of you, and I look forward to the presentations and discussions in the next couple of hours. Thank you also to everyone who has joined to hear the results, to all of the team across all of the countries, and again to just all of the deep hard work. I know that through COVID and there were lots of different obstacles that came up, and everyone
really pushed on, and we have been very impressed at the results. I now have the honor of introducing the Ambassador of the State Department's Office to Monitor and Combat Trafficking in Persons, Cindy Dyer, to give some remarks. Over to you, Cindy.
Thank you so much, Natasha, and good morning, y'all. I am so excited to be joining you today for the 2023 Prevalence Reduction Innovation Forum Conference Results from the Field. My name is Cindy Dyer, and as Natasha noted, I'm the U.S. Ambassador at Large to Monitor and Combat Trafficking in Persons within the Trafficking in Persons Office at the U.S. Department of State. And I am thrilled to see UGA and all the research teams coming together to discuss the results of 7 prevalence studies funded through the Prevalence Reduction Innovation Forum. The State Department's support for such a systematic undertaking in human trafficking prevalence research is unprecedented, and we are eagerly anticipating today's presentations that will showcase the insights and lessons learned from these studies, as well as the findings from the meta-analysis. As far as we are aware, this is one of the first pre-identified meta-analyses on human trafficking measurement. The significance of these cannot be overstated, and there is much cause for excitement as we delve into the results and implications of these innovative research endeavors. As most of you know, the TIP office funded the PRIF to identify the best methodologies for documenting the prevalence of human trafficking in a systematic way. It enabled those working to advance the science behind human trafficking prevalence research to come together for the first time and begin to identify the most effective methodologies for doing so. We are excited that an idea conceived nearly 4 years ago in the midst of a global pandemic has gained so much traction and interest, as evidenced by the number of people joining us virtually at this conference today. I believe more than 300 people registered, so welcome. This conference is unique in that it brings together researchers, practitioners, and policymakers from all over the world to discuss the findings from the 7 prevalence studies, along with challenges, lessons learned, and what's next when it comes to measuring the prevalence of human trafficking. By sharing knowledge and expertise, we can not only begin to build a more comprehensive understanding of how to measure the prevalence of human trafficking, but also generate the evidence necessary to develop more effective policies and programs to respond to the crime. In just a few moments, Dr. David Okech, Professor and Director of the Center on Human Trafficking Research and Outreach at the University of Georgia and the driving force behind the PRIF, will launch the PRIF Learning Series. The series will provide more in-depth presentations of the results from each of the 7 prevalence studies and an opportunity to engage in a discussion with the research teams. Please be on the lookout for the invitation for these events in the coming weeks. We are also very excited for the upcoming special issue in the Journal of Human Trafficking that will include articles from each of the research teams that provide a more in-depth look at how the various methodologies played out in their contexts. It should be published sometime this spring. I am sure that David will be sharing the issue with you all as soon as it becomes available. Today, we will hear from some of the world's leading academics on human trafficking. For many, this will be their first time sharing the findings in a public forum. This infusion of knowledge should be a game changer for the anti-trafficking field, and I am grateful to have a front row seat, even if it is virtually. I would be remiss if I did not highlight the incredible work of the local research teams. Shout out to y'all. These studies would not have been possible without your dedication over the last several years. You have been on the front lines, not only of the research, but in the fight against human trafficking. And we are so profoundly grateful that you were able to join us today. I know some of you are joining from Brazil, Costa Rica, Morocco, Tanzania, Tunisia, and even Pakistan. Your contributions to these discussions are absolutely critical to move the field forward, and we look forward to hearing from you, especially in the PRIF Learning Series sessions that I mentioned just a moment ago. The research teams have completed the hardest part, the data collection and analysis, and we hope that this opportunity to share the study results will lead to the development of more tailored and targeted interventions and policies to prevent and respond to human trafficking, including by those of you in attendance today. As you reflect on today's presentations, I challenge each of you to think ahead, to think about what is next when it comes to how these findings and research more broadly can help build stronger knowledge on the scope of trafficking in context and help to provide important information for the design and evaluation of counter-trafficking programs so we can better identify what works to prevent and respond to the crime. Our office has also recently funded the International Labor Organization to work in collaboration with UGA, the UN Office on Drugs and Crime, and the International Organization for Migration to develop universal guidelines for prevalence research on human trafficking and forced labor. We see this as a crucial next step in improving the science behind human trafficking prevalence research. This project builds directly on lessons learned from the PRIF, as well as those of these international organizations, and represents the first time that the guardians of key legal instruments, the Trafficking Victims Protection Act, Palermo Protocol, and Forced Labor Convention number 29, are coming together to reach a consensus around prevalence measurement. The goal is to have the guidelines adopted by the UN Statistical Commission, facilitating consistent measurement and analysis of human trafficking and forced labor on a global scale for the first time ever. Before I hand the microphone over, I want to recognize the hard work of Dr. David Okech and Dr. Lydia Altreris over the course of the project, including in the organization of this conference. I know it was no small feat. So once again, thank you all for your commitment to the PRIF and more importantly, for your contributions to the anti-trafficking field. So without further delay, I give you Dr. Okech.
So good morning again, and thanks so much for joining us from wherever you are. As you've heard, I'm the director of the PRIF, and I'm also a professor here at the School of Social Work. The Prevalence Reduction Innovation Forum, or PRIF, is the boldest and most comprehensive attempt yet at assessing the strengths of the existing and innovative sampling strategies to estimate the prevalence of human trafficking. It is a testament to the need to transform prevalence data into baseline and endline data that can inform and demonstrate program effectiveness. So my presentation is divided into 4 main sections. I'll start by providing a brief background to the PRIF and highlight chief prevalence research. Then I speak in detail about the PRIF project, including the PRIF core indicators, and briefly mention the meta-analysis aspect of the project. I conclude with the lessons learned through the PRIF project and offer future directions for the project and broader prevalence work on trafficking in persons. The twin goals of the project were to identify and build the capacity of human trafficking research teams in the science of human trafficking prevalence data, and also to document the robustness of the various methodological approaches and sampling techniques in human trafficking prevalence research. I am so happy to say that we have largely met these goals. As you can see, over the past 3 years, the PRIF project has been extremely busy. And in May, for example, we had a major virtual conference attended by close to 1,000 people worldwide, where teams introduced their research projects and we spoke about the vision of this project. We developed an indicators document with accompanying suggested research questions in July of that same year. This document is available online, but is also still a work in progress. In May of this year, the research teams gathered here at the University of Georgia for a technical review and discussion with us and our experts, as well as our funder. In that meeting, we discussed preliminary findings and provided comments and feedback for our research teams Today, the teams present in brief these findings. There will be an opportunity for more detail about the respective teams' findings in learning series that are planned over the next few months, as you've heard from Ambassador Dyer. Among many outputs, we have planned a special issue in the Journal of Human Trafficking that should be out in the spring of next year. Please be on the lookout for this issue, and we hope it will be another building block in the science of human trafficking prevalence reduction. There are other outputs planned over the next few months and years, and I will capture some of these in the final section of this presentation. Efforts on human trafficking prevalence data has been ongoing over the past 20 years, but there is debate over existing estimates. In other words, no one really knows how many people are trafficked across the globe. And this debate springs from a need for standalone methodological robust sampling strategies to estimate human trafficking. Underline, there is not one standalone perfect method for estimating the prevalence of human trafficking. Therefore, designing a methodologically sound estimation method requires significant intellectual and financial resources and a long-term perspective that is informed by local conditions, because trafficking victims are usually difficult to locate, and conditions that lead to trafficking are dynamic and can even shift dramatically. There exists national level aggregate data on human trafficking estimates, which offer policymakers a starting point for designing policies to reduce the problem. But even these have been contested by researchers because they may contain ecological fallacy. This is the assumption that what is true nationally is also true for all administrative districts or even demographics. We know that human trafficking in all countries is concentrated in hotspots. Challenges in reliable prevalence data can therefore be seen to result from unstandardized definitions and challenges of locating victims. Unreliable data in turn affects interventions and policies that can help survivors. It is also difficult to assess the effectiveness of our work with unreliable baseline data. Even when we use RCTs, the various groups contain baseline or wave-one data to help us make a comparison at subsequent waves, thus helping us to document the strength of our interventions. Accurate prevalence data to baseline is therefore integral to our work in reducing human trafficking. The PRIF project addressed some of these challenges with a focus on hotspot data. We also know that the PRIF project has greatly improved existing sampling techniques in human trafficking research. As I have mentioned before, there are two main challenges in human trafficking research. One is the conceptual issue, because human trafficking rosters, as we have witnessed, can include other vulnerable populations. This problem is not unique to the international context. It is also present in the US and other developed countries. Apart from conflation with other vulnerable populations, including human smuggling and sexual assault, we have also seen those at risk of trafficking being counted among actual victims. Researchers can help NGOs and governments to develop better indicators of human trafficking. The second challenge has to do with the ability of researchers in collaboration with other stakeholders to collect accurate and reliable prevalence human trafficking data. Given the fact that most trafficking victims may not be randomly distributed in the general or even target populations, specialized sampling techniques and advanced data analysis are required to capture reliable and accurate estimates. Many researchers face this challenge. The PRIF project, as already stated, addresses these challenges. However, getting accurate prevalence data on human trafficking can be time-consuming and expensive, as many people here would attest. The question is then asked, is it an important area of inquiry, or should resources be spent on programming or policies to help victims and survivors? I believe the answer to that ethical and scientific question is that it is important to prioritize the immediate needs of victims and survivors through contextual prevalence research. We should all demand that prevalence research includes drivers and facilitators of trafficking, strengths and resources at the individual, household, and community levels, gaps in existing policies and interventions, a needs assessment of critical stakeholders, including survivors, and some prescription of policy and programming activities in the short and long term for survivors and victims. In other words, the baseline numbers should be put into context. The same approach should be used if end-line data is collected. In fact, we propose a mixed methods approach to conducting prevalence research. So yes, we need baseline data, and we need to respond to the needs of those we serve in a data-driven and evidence-informed manner. Given these challenges, we are so grateful for the bold partnership that was funded by the US Department of State Office to Monitor and Combat Trafficking in Persons. Their significant funding of $5 million is the largest prevalence research support in the history of human trafficking prevalence research. The scope of the project is also the largest in terms of researchers and countries in the area of human trafficking prevalence research. So we are very, very grateful to the Department of State for their support. So the PRIF project included 7 studies in 6 countries spanning 3 continents or 3 major geographical areas. Brazil had 2 research projects, and that explains why we have 7 research teams in 6 countries. At least 6 sampling techniques were used by the 7 research teams. This included probability proportional to size, or PPS, respondent-driven sampling, or RDS, Vincent link tracing sampling, or VLTS, time location sampling, or TLS, stratified simple random sampling, or STSRS, and the network scale-up method, or NSAM. Teams were required to use at least 2 sampling methods to document human trafficking prevalence. And of course, as I said, we used a hotspots approach, and the findings, therefore, are not generalizable to entire respective countries. As you can see, we brought together the best multidisciplinary researchers in the field globally. Our principal investigators included Yuki Lowell from the Freedom Fund and Dr. Carl Kendall from Federal University of Ceará in Brazil, and Dr. Ana Brito of Oswald Cruz Foundation. They studied child sex trafficking in Recife, Brazil. We also had Dr. Grant Miller and Dr. Kim Barbies from Stanford University, who studied forced labor trafficking in the agricultural sector of Brazil. Dr. Cortland Robinson from Johns Hopkins University studied forced labor trafficking in the brick kilns in the Sindh province of Pakistan. Dr. Meredith Dunk from the New York University studied forced labor trafficking in the fishing industry in the Pacific coast of Costa Rica, as well as domestic servitude in Dar es Salaam, Iringa, and Zanzibar of Tanzania. She was a principal investigator in Tanzania and Costa Rica. Karim Kisia from NORC at the University of Chicago studied domestic servitude in Casablanca, Morocco. Last but definitely not least, Dr. Sheldon Zhang from the University of Massachusetts, Lowell, studied domestic servitude in Tunis, Tunisia. So as I said, one of our outputs was to develop a standardized TIP definition and indicators document, human trafficking definitions and indicators document. And to address our challenges, we collaboratively developed this document, whose goal was to help at developing uniform measures for the teams. This document went through several iterations with feedback coming in from our research teams and a team of consultants, including our local collaborators. The goal of the statistical document was to identify key indicators of human trafficking and standardize the measures of human trafficking for the PRIF researchers. Standardized measures would enable better comparisons across the various methods and studies. We developed 39 indicators and considered 12 of these 39 to be core indicators of human trafficking. The PRIF teams were required to use the 12 strong indicators. These 12 can also be adapted and used by other non-PRIF researchers and organizations that seek to measure human trafficking prevalence for research or programmatic evaluation. For the purposes of the PRIF project, we rated the indicators in a scale of medium, strong, or very strong. It was important to map these indicators to the conceptual trafficking definition by the UNODC, which emphasizes the 3 main elements of identifying human trafficking. And those 3 elements, as most of us know here, are the act, the means, and the purpose of human trafficking. We did not want to reinvent the wheel. Therefore, the PRIF indicators document is mapped into this UNODC definition, as this is the framework for just all anti-trafficking work across the world. But the PRIF indicators document, if you've seen it, includes a little bit more details. The 39 PRIF indicators fall under the following 7 domains: recruitment, employment practices and penalties, personal life and properties, degrading conditions, freedom of movement, date or dependency, and violence and threats of violence. We also suggest questions for each indicator. For example, under the domain violence and threats to violence, indicator V2, which is considered a strong indicator, and the indicator says ever been sold or witnessed ownership of another person in your situation, being sold for labor or for sex, can be captured by the question, do you believe you are ever sold for labor or sex by someone? For those saying yes, researchers can then probe a time frame ranging from 3 months to 24 months. We also developed thresholds for identifying human trafficking victims for use in the project. We targeted adults 18 or above who were engaged in commercial sex or labor services. The first threshold was for those who presented one very strong indicator. These are, for example, PL3, made to work or engage in commercial sex to repay outstanding debt or wage advance, or FM3, no freedom of movement or communication, or DD2, tradition, birth, descent into hereditary slavery or bonded status, or VV2, ever been sold or witnessed ownership of another person in a situation being sold for labor or for sex. Under threshold 2, for someone to be identified as a trafficking victim, they had to present 2 or more strong indicators from any of the 7 domains. Just 2 strong indicators from the same category without an additional indicator from a different category will not qualify as a trafficking victim. Okay, so we are beginning to get to the most important part. As we stated, teams were required to use at least 2 sampling methods in establishing the prevalence of human trafficking. Using our thresholds, we find that apart from Johns Hopkins study, the prevalence rates by threshold 1 are lower than threshold 2 in all the studies. This is not surprising because of the conservative nature of threshold 1. In the Johns Hopkins study, we find that the differences by threshold are not significant, however. The Freedom Fund study focused on adults who were asked about the experiences as minors and thus did not use the thresholds. But their RDS and PPS rates have significant variance. Most people who have used NSAM have reported that it frequently underestimates tape victims. And that is why you see the NSAM, which is nested in the PPS for the Freedom Fund study, has lower values. The overall prevalence rates include victims who met the thresholds for 1 and 2. Stanford University is still completing their study and their rates are not presented here. So if you look at this table very carefully, you see that we have differences, of course, by thresholds, but also within those studies, we have differences by sampling methods. We also attempted a cost-effective analysis of the various sampling techniques. This is something that has never been done as well, to enable stakeholders to determine a method that can provide fairly reliable estimates at a less costly price. For instance, if I can get decent estimates using a method that is less time-consuming and less expensive, should I then choose that over a method that might give me more accurate estimates but cost more time and money? Like in most things, I believe the compromise is somewhere in between. Better estimates provide more reliable baselines that can then inform program effectiveness. I must add very quickly, though, that this is not an imperfect attempt at actuarial science. As our teams found, there is a question about fixed versus marginal or incremental costs. For example, training data collectors in the first sampling method saves money when you use the same enumerators for the second sampling technique. The assumption is if we were to start from scratch and do one method, what would it cost? That is, if we were to start from scratch and train people to do one method and then start from scratch and train people to do a second method, what would it cost? But this assumption does not hold in our case. The cost of doing the research are from our own study, from our own study of the team's budgets, and also our polling of the principal investigators of these teams. Results show that where PPS was used, it was always less costly than other methods, especially controlling for sample size with Stanford study. It is also important to control for factors like studies that require coupons like RGS and VLTS, and also the countries, the cost of living in the countries. Cross-country comparisons may therefore not be tenable because there are many sources of unmeasured errors. Still, this is a great attempt at finding the most cost-effective sampling strategies in prevalence research in human trafficking. So to return a critical outlook of our work, we instituted a meta-analysis process that is still ongoing and whose goal is to assess the relative biases of the different prevalence estimates and to document the cost effectiveness of each method. In the previous slide, I spoke about the cost effectiveness issue. This will remain an ongoing inquiry as part of the overall meta-analysis plan. Though the settings in which the studies were done vary by many factors, we describe our methodological settings as fairly harmonized because of the use of the standard threshold measures to identify trafficking victims. The meta-analysis work will culminate in an R package that others can use to replicate our findings and compare the sampling techniques across studies. For example, comparing PPS across 2 studies. So just to share a little bit about the effort that we've put already. So this is coming up. This is going to be a wonderful website. This is a screenshot of the meta-analysis platform so far as it is. Of course, we are going to improve on it. We will soon be reaching out to other researchers who have data that could be entered into a platform to enhance our meta-analysis. One of the main challenges currently is the limited number of studies that we currently have for this meta-analysis. Just 7 studies is good, but not good enough. Our goal is to increase the number of studies from other researchers so that we can have a better meta-analysis plan. As we have seen, PPS provided more reliable estimates and perhaps more cost-effective, was perhaps more cost-effective than other methods. The same methodology and sampling strategy in different studies produce different levels of biases and errors. For example, RDS, when applied to one study, will have different levels of errors and biases because it is so dependent on many detailed steps and factors. So our prior model or our hypothesis will be updated to reflect these new realities. Also, the same sampling techniques across studies have weak overlaps. Therefore, our prior assumption really needs to be adjusted. So in other words, we are learning through this process as well. For many years, the use of administrative data was widespread among researchers, NGOs, and governments. Building on that foundation, we find that other methods, including RGS, VLTS, and TLS, can be useful in hotspot situations within specified enumeration areas. We can't overemphasize the strength of PPS as we plan on curating and managing a platform that will include more studies as we improve on the science of prevalence estimation in human trafficking. So, these are just, some of the methods learned, and I divide the methods into methodological and statistical. So, in the methodological portion of what we learned, PRIF tested the various methods so other researchers know what sampling strategy to use under what circumstance. So in other words, we've done for many people so that they know what methods to use under what circumstance. Today, we have presented preliminary results, but over time, we will submit more detailed prescriptions methodologically using 2 or more methods of prevalence estimation. It's still better than using one. I still believe that using 2 methods is still better than using one. If you use just one technique, it is important, however, to ensure rigor in meeting all the assumptions of that method. But we have learned that there is no one best method for prevalence estimation. Research should include different strengths. Research teams should include different strengths, including methodologists, statisticians, local context experts, subject matter experts, and in many cases, would really encourage people with lived experiences as part of research teams. Also, the standardization of trafficking indicators is necessary for the anti-trafficking movement. We'll continue with the process of working on the indicators document, as we've said. Some of the lessons that we learned from a statistical perspective. Statistically, the meta-analysis exercise can be improved by increasing the number of studies, as we've said, and also conducting traditional meta-analysis where we go deeper into the studies to unravel unique idiosyncratic characteristics and compare or contrast with other studies. Independent technical statistical support enhances the work of researchers and provides a second set of eyes in an internal review process. Again, the standardization of the definition and indicators of trafficking is necessary and needed. So based on these lessons and based on this work, we've thought of some future directions, the things that we could do moving forward. So based on these lessons, our plans over the next 5 years and beyond are to complete a set of human trafficking indicators documents by the end of next year. Also, we want to extend the current meta-analysis to a broader spectrum by using a conventional but more holistic approach. We want to do this for the foreseeable future. Also, we want to devise a series of new robust methodologies and software that are specifically tailored to the nature of human trafficking prevalence study, not just hidden populations. We hope to do this in the next 3 to 5 years. We also want to build a PRIF repository of human trafficking prevalence data and tools that can be replicated and used by users within and beyond the human trafficking community into perpetuity. In addition, we also want to unify and standardize the definitions, terms, and terminologies pertaining to the sampling designs across the studies. This will be done over the next 5 years. Also, as part of the meta-analysis, there is need to use post-weighting strategies to improve prevalence estimates. Because of the complex sampling designs needed to reach hidden populations, and in particular the trafficked members of those populations, it is essential to properly use sampling weights when constructing population estimates and standard errors. Sampling weights help account for how likely or unlikely it is for a particular person to have appeared in the sample. Without sample weighting appropriate for the design, estimates will likely be biased and unrepresentative of the study population. There is also a need to develop a user's manual for the PRIF indicators document, including the 2 hard threshold approaches and potentially a softer threshold approach. The manual could also be used for other target populations. There is also a need to improve the speed of research translation and utilization. Conducting proper research takes time, but once we have data, we can quickly analyze the variables that are of urgent need for policymakers and practitioners. Prevalence baseline reports should not delay the onset of projects or affect the fidelity of interventions. Rapid qualitative analysis of large data sets in our experience can take 1 to 2 weeks as long as the preparatory work is done in advance and the template is ready. We just did that for our PEMS-6 work in Malawi and Zambia to get preliminary findings. Prevalence estimates can also be calculated as data is entered from the field. We are currently doing the same in Malawi and Zambia. And the full baseline report can always come a little bit later so that the project is not delayed. Another direction that we're thinking about is we have become students of our own work and research. I must say how I have personally grown through the PRIF process and how that in turn has helped our own projects. We are using PRIF thresholds in addition to more probing about the possibility of work and exploitation conditions that people may have experienced. Please be on the lookout for our PEM6 baseline report that includes prevalence data in the next few months. Wow, so that has been, this has been a wonderful 3 years. And I just want to acknowledge people who've been so pivotal to the PRIF work. So the PRIF will not have been possible without the able support of Dr. Lydia Alektraris, who coordinated all the PRIF efforts and activities. It has been a great honor working with Lydia over the past 4 years. Dr. Katie McLaughlin, Associate Professor, Department of Statistics, Oregon State University, Dr. Lisa Johnston and Dr. Ian Fellows, all independent consultants, provided statistical and methodological support to the teams, as did Dr. Dennis Feehan, Associate Professor of Demography at the University of California in Berkeley, who was our NSAM expert. Dr. McCartan Humphreys of WZB Berlin Social Science Center and Dr. Gosha Shunyaev, a senior professor, Department of Political Science at Vanderbilt University, helped with the meta-analysis aspect of the project. Andre Gallant, our communication director, and Hope Dockwell, our policy officer, helped Dr. Alektraris in the planning of this virtual conference. Right now, they are in the background, and when I was not able to find my slides at the beginning, actually, Hope rushed in here and helped me real quick. She fixed the problem. Last but not least, we very much appreciate the support by the office, by the Department of State, Office to Monitor and Combat Trafficking in Persons. And the staff there, including Dr. Casey Risco, has been a very supportive and responsive grant officer. And Natasha Greenberg, Director of Program to End Modern Slavery, has been very encouraging and offered wise and critical counsel. We hope that this partnership will continue into the future. I have a set of some of the references that I used for my slides here. So there they are. And yes, so we thank you so much. And I think now it is time for a short break. Thank you so much.
Thank you so much, Dr. Okech. Yes, it is indeed time for a short break. So grab your morning or afternoon coffee, stretch your legs, and we will reconvene back at 10 a.m. Eastern Time, which is in 10 minutes. Feel free to drop any thoughts in the chat. And if you have any questions, use the Q&A feature, and we will see you back here at 10. Thank you. Welcome back, everyone. Hope you had a chance to stretch your legs for a minute. We are ready to resume the second portion of our session, which will include the presentations by the 7 research teams on their prevalence studies. And up first, we have the study by Johns Hopkins University. Please welcome Dr. Cortland Robinson. Over to you, Dr. Robinson.
Thank you all. Can you see me and hear me? Just give a wave or thumbs up. I'm going to keep track of time. I see a clock behind me, so I'll be watching that. But very glad that my colleague and co-PI, Zafar Fatmi from Aga Khan University, can join. He's traveling. I think he's in China, so connections may be problematic. I think I'll do most of the talking, if not all. Hopefully more time for him to join in and maybe other colleagues to weigh in with comments in the chat. But let me just move forward. Next slide, please. So we were estimating prevalence of forced labor in the brick kiln industry in Sindh province in Pakistan. I'm going to walk you through these 5 elements that we were asked to cover in 10 minutes. So we'll keep an eye on time and move right along here. So next slide, please. In terms of background and context, there is substantial debt bondage in Pakistan, as they often use that term. 3.2 million victims of modern slavery, about 2.1 million working as bonded laborers. This comes from Global Slavery Index. Not sure exactly how accurate those are, but that's where we started, kind of baseline. And many thousands, tens of thousands of kilns across the country employing 4.5 million brick kiln workers. So it's quite a widespread, a large industry, and debt bondage is absolutely saturated throughout. And it often correlates with vulnerability, migration, poverty, religious minority status, and people in lower SES and caste statuses. Next slide, please. Ours was a mixed method study, so we incorporated qualitative and quantitative. We also were significantly disrupted by what was called a super flood in September of 22. And I'm very pleased to say that our donor and sponsor and UGA were very helpful in allowing us to not only stand down the project, but also build in a flood impact assessment, qualitative and quantitative, which we use to assess impacts of the flood on forced labor conditions and constraints on freedom of movement, among other things that were evident based on our qualitative and quantitative research, and even supported some direct relief aid. So really very, very grateful to UGA and all the donors and sponsors of this work to give us both the flexibility, but add in an important measure of flooding, which is a common condition exacerbated by the effects of climate change. I'm going to talk only about the quantitative results given time, and even there limit ourselves to the results from the PPS and the RDS. Hope you're all familiar with these acronyms now. We'll use them a lot. Not present the NSUM data. Thank you. Go ahead. Next slide. Thanks. The PPS was basically selecting from a number of, purposely selecting from a number of kilns based on our extensive community mapping of, we attempted to map every single kiln in Sindh province and then use that to design a purposive draw based on selected districts, but looking at different characteristics of kilns, total numbers of workers, and so forth. But we selected 80 brick kilns and interviewed 10 households within each kiln and did some post-sample weighting, because obviously not all kilns had the same number of workers at each site. And basically one member of each household was asked to participate, both for security and to incorporate just at least one measure of these many different modules. We had 15 different modules. I won't get into all of them, but certainly, of course, including the PRIF indicators to measure forced labor in the brick kiln industry. So that's the PPS. And next up is RDS. Next slide, please. Here we had 2 seeds, 1 male, 1 female, identified purposefully based on the districts, 8 districts. So we did the RDS in the same districts where we did the PPS, distributed 3 coupons per person as is sort of general default, if you will, and reduced it to 2 because it was such a high response rate. Everybody wanted to give out a coupon and participate in the study. So we had to scale it back so that we could extend out to what we were hoping to get, about 6 or 7 waves, which we did. And on the right-hand side, you see the RDS network graph just simply shows how seeds sort of propagated and which generated rather productive networks and which were somewhat more isolated and scattered. Next slide, please. So basic characteristics. We did not get the same sample precisely. Generally, we found low SES, about 90% reported no formal education. 2/3 had incomes were classified as the poorest. And as I get into risk factors, that was a risk factor. Being among the poorest and having low education was correlated with higher prevalence of forced labor. And the sampling methodology, I won't walk through all of these, but basically the characteristics that showed up as significantly different, statistically significantly different, comparing RDS to PPS were marital status and mean age. It was a higher mean age among the RDS and a more higher likelihood, higher probabilities of being married among the RDS population. Next slide, please. Our prevalence estimates, as you can see here, were quite different. And this was something that struck us and remains of interest to us to explore why. Not only did threshold 1 and threshold 2 basically come up with the same results, i.e. adding some additional strong indicators in threshold 2 didn't seem to move the needle, that you were capturing much of that same forced labor risk, if you will, just in threshold 1. It didn't change very much. In fact, it slightly declined, but these within the margins of error, the confidence intervals overlap, so we can't really conclude that they're different. Threshold 3, lower prevalence, then we did a composite or overall that included meeting any one of the 3 thresholds. So our study found that RDS, somewhat to our surprise, was showing higher prevalence rates, quite dramatically higher than PPS. But I noted for the first time, and I checked it with Lydia just to make sure I didn't get the slide misinterpreted, another study, a Freedom Fund study in Brazil, found very much the same relationship, a lower rate for PPS than for RDS. And that's interesting to us, and not sure why, because we thought context mattered, and it may be that context mattered, but it was a different kind of situation, but it's something to explore. And I think it speaks to the strength of this network, that we can look at each other's work, we can talk to each other, we can compare notes, we can look at what we think we did well and how effectively we carried out these samplings, and what might have come up in terms of limitations, the kind of non-sampling error, and just simply variation that you get in sampling. And it really speaks to the strength of this idea and the support that obviously JTIP and others have brought to this work. So I just simply want to commend all of you that we can do this work not just on our own over time with colleagues like Aga Khan University and with, in our case, SPARC, the Society for the Protection of Rights of the Child, which is helping us run an intervention on counter forced labor activities, but to be able to work with each other. Next slide, please. A little bit busy, but on the right-hand side, you'll simply see where we've bolded the statistically significant differences It's interesting and confusing to say that in the RDS sample, forced labor prevalence was significantly higher among females, but it flipped with the PPS. As a researcher, you kind of don't like to see that, right? And you have to say, is it a different sample? It may be. Was it different contexts? And we'll get into that, I think, in the limited time I have left, maybe a minute or so. But that's the kind of thing we need to worry about. But it's also the strength, even though it brings forward sort of complications like this that you have to figure out, of bringing two samples together. And this is such a rare opportunity. But no formal education, certainly in the RDS, proves statistically significant associated with forced labor, lower caste, and people in the poorest quintile, both showing up in either the RDS or in the case of the poorest quintile, in both the RDS and the PPS. Next slide, please. So prevalence of forced labor was common, i.e. 18 to 31% meeting at least one PRIF threshold, but higher in RDS and PPS. Only one exception, freedom of movement, was somewhat more common in PPS than in RDS, but generally speaking, RDS indicators were almost double in most instances. But as I said, turns out we're not the only study that found that, and we need to compare notes a little bit more. For us, we felt that the lower estimates from the PPS suggest that the location of the interview is such a key factor. In the PPS, as we were interviewing at cluster level and finding an index household and then moving kind of next nearest, that there was seemed to be an awareness of both proximity to the kiln and an awareness of at the community level of there's a study going on, and we feel that maybe the RDS participants were somewhat more protected by being able to recruit one another than our study team recruiting them. We didn't find any evidence of any retribution, but it is something to think about. The other point we would make is that while there's, of course, a need to focus on prevalence, it's also important to think about other factors. For us, mental health measures came up strong as a potential risk factor, as well as many different issues relating to occupational health and safety. So I'll finish with simply a note that in our intervention implications, we changed our study design from panel survey, which would have been sampling among, we hope, a fairly comparable population from baseline to end line, to an open cohort, case control, longitudinal design, to invest in really finding people, tracking them through the intervention over 2 years plus, and then interviewing them again at end line, or finding if they're lost to follow-up in some other way. And we've also incorporated much more of a significant focus on occupational health and safety, with mechanisms for referral and in some cases treatment costs for those with more serious injuries and health issues. So I hope I've not run over time and captured the key elements. And if my colleagues Zafar and others have other things to add, maybe there'll be time at the discussion session to do that. Thank you so much.
Thank you so much, Dr. Robinson. Up next, we have New York University and Dr. Meredith Dank. Over to you, Dr. Dank.
Thank you so much. Good morning, good afternoon, and good evening. I want to, before I begin, thank all of my amazing partners on this project. So my co-lead on this, Dr. Sheldon Zhang, is not here today, but he's from the University of Massachusetts Lowell. Amana Mbisi from the University of Alaska Anchorage was a consultant on this study. And then I know Faraha Dimitrios is tuning in and should feel free to chime in as well, from the local organization ComHESLA, who did all of the data collection and amazing work on the ground. The next slide. So we specifically looked at women who have worked as domestic workers abroad and have returned back to Tanzania to determine what their experiences around domestic servitude were like while working abroad. So what we do know a bit about Tanzania is described as a source, transit, and destination country for men, women, and children, and is a hotspot for migration and transnational trafficking for domestic servitude specifically. Before this study was undertaken, there had been no studies done on the prevalence of domestic servitude with this population. Next slide. So the target population, I don't necessarily want to correct you, but I will correct you, David. In your presentation, you had mentioned that we included Iringa. Unfortunately, that was initially we wanted to include Iringa in the study, but we had to not due to cost implications. So we focused on Temeke district in Dar es Salaam in Tanzania, and then 2 districts within Zanzibar, Mjini, Magharibi. And I apologize to anybody on this call from Tanzania if I mispronounce that. Next slide. And just to clarify that we only focus on women and women who are 18 years and older who went abroad to work as domestic workers. So we used 2 methodologies. Originally, we were going to use the multi-stage probability proportionate to size, similar to Cortland. However, due to some sampling issues that we encountered, we revised it to stratified simple random sampling. I do want to note that I also neglected to mention that Dr. Kyle Vincent, who's also tuning in, was, the genius behind these estimates, and also will be happy to answer any questions regarding the estimates if you have them. So with this, particularly for the SCSRS, because we were originally going to rely on administrative data from the government, and it turned out that it was not as robust as we had hoped, we did a mapping exercise to generate a sampling frame of households within those 3 districts that we had mentioned in Dar es Salaam and in Zanzibar. So we did the initial mapping, and once we identified which houses the domestic workers, returned domestic workers lived, we went back and asked them if they want to participate in the survey. I will mention that this was incredibly expensive. We were not initially intending to do the mapping exercise, which you can imagine takes up a lot of resources, both financially and human-wise. And so, this was a huge undertaking that COMHESWA ended up doing kind of last minute. Next slide. The other sampling, the other method that we used was the multi-wave link tracing sampling, which was also referred to as the Vincent link tracing sampling, which as Dr. Kyle Vincent had done, which is kind of an iteration of responder-driven sampling. Similar to RDS, link tracing sampling works well when attempting to reach hidden populations. And so what we did was identified within the SCSRS mapping, identify folks who might also be good for the network sampling piece to this. And so we were able to identify a large number of seeds. So what is different between the VILTs and the RDS is that we use a lot more seeds than in RDS. And as you can see, this was very difficult to implement because, not surprisingly, a lot of domestic workers are kind of isolated. They're not as networked necessarily. So as you can see by this sample graph, there were some trees, but a lot of isolated nodes, so those green little circles that are not connected to one another. So as far as the networking goes, this methodology might not be ideal with this specific population. Next slide. So what we were able to determine as far as the size of the returned domestic worker populations with the SCSRS was that it's about 2,180. This was, as you can see, based on an ad hoc method, which is described in more detail in the final report. Whereas the LTS method had a very large range, and that is also due to the isolated seeds and limited networks. So that range was between 2,000 to 16,000. So when we're talking about ideal methods and what works best, when it comes to the estimation of the size of the populations, what we determined is that these methods are both pretty difficult to actually measure the size of returned domestic worker populations. That said, this was somewhat covered by David and by Cortland, but just as a reminder, we did not look specifically at threshold 3. We only focused on threshold 1 and threshold 2. So threshold 1 included having to perform sex acts to pay off debt or receive wages. in addition to losing freedom of movement due to surveillance, experiencing isolation, or losing freedom to communicate with friends or family. Whereas threshold 2 made up of 10 categories of indicators, which included a lot of different abuses, physical, sexual, verbal, during recruitment, employment practices and penalties, etc. In order to meet threshold 2, you would have had experienced 2 or more of these abuses. I believe these thresholds are being revisited by a number of different groups, the State Department, UGA, and various UN agencies, to see whether or not this can be changed a bit, given the imbalance of the threshold 1 and threshold 2. Next slide. So when it comes to the actual threshold estimations, our final sample for the SCSRS was 1,052. The overall rate of domestic servitude was quite high. And if you remember David's chart comparing all the different percentages of the thresholds, I believe, unfortunately, this population had the highest when it came to the overall rate of trafficking. So it was around 70%. 38% met threshold 1, 65.5% met threshold 2. If you go to the next slide. Link tracing was somewhat similar, just slightly lower at around 60% as opposed to around 70%. But similarly, 27.5% met threshold 1 and 56.5% met threshold 2. So overall, it was very high. So demographic profiles for both methodologies, again, we only focused on women. Over 70% of the domestic workers were between the ages of 26 and 40. 32 to 36% were currently married in a monogamous relationship, and about 8% had never been married. A large percentage had at least one child, and over a third had 3 or more children, which I think we hear a lot when it comes to why people go abroad to work. And in this case, for domestic work, is oftentimes to support their families back home. And over 90% of both samples reported their highest level of education was either primary or ordinary level. Next slide. So employment characteristics, what is, I think, somewhat unique to Tanzania specifically is that a very large percentage of their women go work in Oman as domestic workers, given the history of Oman and Tanzania, and the fact that they speak Swahili in Oman as well. And the second most common country that the women traveled to was UAE. As far as their pre-departure trainings, there is a government agency named TAIESA that does provide pre-departure trainings, and I'll talk a little bit about, when it comes to our intervention, how we're working with TAIESA. But very few people actually had heard of this agency prior to working abroad. As a result, a little less than half of them did not know that their employer was supposed to take them to the Tanzanian embassy, which is technically part of the law, when they arrived in the destination country. And when it comes to the different types of abuses, between 43 and 51% reported being forbidden to leave the workplace, which is not surprising given that they're domestic workers, and the freedom of movement is often very restricted. But when it comes to the types of physical violence and sexual violence, it's still relatively high. We're talking about, maybe on average 10%. And we recently took a trip to Tanzania and met with several former domestic workers. And when asked about sexual violence, and we determined this was quite an underreported percentage, because some women only interpret sexual violence if there's penetration, but if any other types of assault happen, they wouldn't say yes, that they were sexually assaulted. Next slide. So just general, I know we're running out of time, help seeking. There was quite a bit of help seeking that was reported. Most of the women reported mainly getting help from the Tanzanian embassy or from their employment agency. Most common forms of help were mental health support or being repatriated home to Tanzania. And the reasons for staying in the job were loss of wages and withholding of identity cards. Almost all of the women said that their passport was confiscated upon arriving in the destination country. And several of the women said they were ultimately not helped. So the last couple of slides, I think we'll just skip this one. Some of the study limitations, we were restricted to where we did the study, and some, which was part of it, did not work quite well. We did not do a full-fledged NSUM design, and this population is incredibly transitory, which created problems of network size and linkages. And lastly, implications for programming and policy. We were lucky recipients of funding to do an intervention, which was largely, a lot of it was based on what we learned in the baseline. And what we learned is a lot of the women do not know their rights prior to going abroad. So what we'll be doing, as I'd mentioned, is working with the agency TAESA on pre-departure trainings, where the women will learn about their rights. They will receive a booklet and materials about what their rights are and who they can contact once they are in country, if they experience any abuses or harm. Last slide. And we will also be training employment agency representatives about human trafficking and how to assist women who seek help from abusive employers. There are going to be theater groups that are going to be spreading awareness around the issue of domestic servitude and domestic work abroad at schools and within certain communities. And lastly, we'll be doing a pilot of a vocational training with some women who are considering going abroad, but want to stay back in Tanzania with the hopes that they can earn enough money to do so. So we'll be training them in the vocation of choice to see if they are able to raise enough capital to stay at home instead of traveling abroad. And that is all. Thank you.
Thank you so much, Dr. Dank, for that informative presentation. Up next, we have Dr. Jason Rydberg from the University of Massachusetts, Lowell. Over to you.
All right, thanks so much. Hello. So I have the privilege of presenting our findings on behalf of our research team. Go ahead, next slide. So this research takes place in Tunisia, where we are looking at the prevalence of domestic servitude among female domestic workers. Our research team, comprised many individuals, and I'll be reporting, on their behalf. Next slide, please. So the basic premise in this study is that, again, we're looking at the prevalence of domestic servitude among female domestic workers in Greater Tunis, and we are deploying two different estimation strategies. They're really more kind of two variations on the same strategy, and this is time location sampling and mark recapture estimation. Next slide. So the basic idea behind time location is that this is a hidden population. There's no phone book that we can look up that just says, here's all the female domestic workers. But the idea is that they're likely to congregate in certain areas at certain times of the day. So what we do is we establish a sampling frame that comprises different locations, and then we kind of enumerate those in terms of different times of day that they could be visited. We randomly sample those, and then at each of those locations, essentially screen and kind of randomly identify domestic workers on site for a street intercept interview. And then during those discussions, we would ask them about the number of times that they had visited particular locations at particular times of days, and be able to extrapolate from that to get an estimate of the population prevalence. Go ahead, next slide. So specifically, we had a sampling frame of 356 different sites. We identified 4 different time blocks ranging from 6 a.m. up to 8 p.m. And we importantly, working with our field team, identified certain sites where we thought that foreign migrant domestic workers would be more likely to congregate, as we thought this would be a difficult population to reach. Next slide. So importantly here for the design, we identified 14 venues that were thought to be very high traffic for female domestic workers. And so it was for these 14 venues that each respondent was asked, so, hey, this bus stop, this supermarket, in the past week or, in the past some previous time point, have you visited this location? And they're asked about each of those 14 locations. This becomes fairly cumbersome in terms of, carrying this out in practice, but this is necessary in order to produce the sampling weights that we need. Next slide, please. So on the other hand, for mark recapture, we're using a kind of a similar idea to the time location sample, where we are randomly sampling times and locations, but we are revisiting those for interviews multiple times. We're using certain information like the individual's initials, month of birth, and the digits of their phone number. We could identify whether we have essentially like recaptured an individual, so identifying the same person twice. If you never see the same person again, that would seem to suggest that the population is probably quite large and very dispersed. But if you keep seeing the same individuals over and over, this gives us some information to be able to, again, extrapolate to a population estimate. Next slide. So we completed around 1,000 interviews for each of these strategies. For the mark recapture, the number of unique interviews was 923 because there were 93 recaptures that took place. So each of these techniques produced similarly sized weighted population estimates of, ranging from about 4,000, up to 8,000 female domestic workers across these the greater Tunis area. Next slide. So from that, we were in the course of these interviews, we asked about these different PRIF trafficking persons indicators, which I won't have to go into because Dr. Dank did such a great job talking about them. Please proceed. So what we find is that the prevalence for threshold 1 was lower than for threshold 2. And this was somewhat expected, I believe, when you take a look at the way that those are operationalized. Specifically, what we see is that in the time location and the mark recapture, we see somewhere around 8 to 13% of female domestic workers are reporting meeting threshold 1, while about a quarter are meeting threshold 2. There is, and I'll get a little bit more into this later, there is significant overlap in these populations here, where we see for meeting either threshold 1 or threshold 2, very similar estimates. About a quarter of female domestic workers met those thresholds. Proceed. We also did an NSUM scale up estimation. I'm gonna take this right here. I screwed this up. We could not do a real NSUM. If you look it up online, you look at the papers. I messed that up. So instead, I got bailed out by Drs. McLaughlin and Feehan to help come up with a low budget and some body double. Next slide, please. And what this is based on is essentially asking each of these domestic workers, how many domestic workers do you know? How many experienced this particular trafficking indicator corresponding to threshold 1 to threshold 2, and then multiplying that by our time location estimate to get some indicator of raw numbers. Next slide, please. So what we see here is that our scale up estimator actually produced significantly larger estimates of threshold 1 and threshold 2 prevalence, at the same time with considerably higher variations, so a lot more uncertainty in those estimates compared to the TLS and the mark recapture estimates. There was a bit more correspondence for threshold 1 than there was for threshold 2, but if you go to the next slide, please, you'll see just how much that variation differed. So again, the whiskers here are that 95% confidence interval, and you can just see how wide that is for the scale up versus the time location and the mark recapture. Next slide. So as I mentioned, there is significant overlap here. What we do see is that for just focusing here on TLS, because they are similar. So of those who met threshold 1, 90% also reported meeting threshold 2. And then of those, meeting threshold 2, about 30% met threshold 1. So there is, as we saw, a considerable degree of overlap in terms of, or concentration when it comes to experiencing these particular thresholds. Next slide, please. So I won't go deep into these findings here. I'm going to focus on some of the methodological comparison, but we did examine risk and protective factors for experiencing threshold 1, threshold 2 across our different samples, considering things like respondent demographics, characteristics of their employment, and their social support networks. Next slide. But what we were interested in here is whether the TLS and the market recapture strategies came up with similar conclusions about how those different factors relate to the different tip thresholds. So what we do see is that for threshold 1, there were very similar estimates in terms of when one sampling strategy suggested there was an association, the other one did too. But of the 18 different risk and protective factors that we looked at, 7 of them had what I'll call statistically different associations or distinguishable associations between the two strategies. So for instance, next slide. So right here, this is looking at the number of children that the respondent reports having, and then the probability of them reporting the threshold. So we have time location in blue, mark recapture in green. And just note that for threshold 2, those points line up. Those points just differ in intercept. They differ in level on the y-axis. But for threshold 1, you could see that the more children the respondent reports having, the lower the probability according to the time location, but the higher according to mark recapture. Next slide, please. Similarly, so for this is looking for the number of employers that they worked for. Essentially, time location is reporting that working for more employers is a risk factor. It increases the likelihood of trafficking, while that association is null for mark recapture. Next slide. And then for the duration of their commute to work, both indicators have completely opposite associations for time location and for mark recapture. Not entirely clear on why this is. Again, we don't necessarily have a absolute benchmark to compare these two, but it's certainly something that we want to dig into. Next slide. So importantly, so both these strategies seem to produce very similar estimates of the population size, except for NSUM. We'll forget that that one exists for a minute. They're pretty similar. The weights have very small design effect. This is beneficial. However, what we will note is that in practice, the mark recapture estimation was much easier to implement in the field. This is coming from our field partners, where, again, those frequency of venue attendance items from time location are just so cumbersome to ask about in interviews. Mark recapture is significantly fewer items. Next slide. One additional limitation here with time location was that we originally had based the estimation, when I say we, so again, big thanks to Dr. Kyle Vincent for his expertise here. On these 14 kind of primary venues, we realized that this missed a significant proportion of the population. And so we had to engage in some kind of sensitivity strategies in order to capture more of that information. And again, these frequency of venue attendance items for time location produce a lot of fatigue. Next slide. So other limitations, just to note here, we did have very few migrant domestic workers that were captured in this analysis. So it is because we are intercepting individuals on the streets, I think we're going to consider this as being an underestimate of the number of foreign migrants who are there. Clearly, some different strategy is necessary in order to reach these populations. We're also, because we're setting our sampling strategy in public places at mostly during the day, if these groups are in transit at other times, we are missing them there as well. We can't know right now how consequential those challenges are. Next slide. That's it. Thanks so much.
Thank you so much, Dr. Rydberg. Let's see. So up next, we have the Freedom Funds presentation, and we'll be hearing from Dr. Elizabeth Anderson and Dr. Carl Kendall. Over to you, Dr. Anderson.
Hi, thanks so much. I also wanted to mention a couple of our other team members who are critical to this project. Dr. Ana Maria Brito, who's the PI of the project. She's based out of the Oswaldo Cruz Foundation in Brazil. Dr. Marto Leal, Dr. Lygia Kerr, who's on the call, and then Deborah Aranya and Yuki Low of the Freedom Fund. Next slide, please. So our study was looking at a population of children under the age of 18 who are engaged in commercial sexual exploitation. And so by definition, the use of children under the age of 18 to perform sexual acts in exchange for money, goods, or other favors is commercial sexual exploitation of children. We interchangeably refer to that as CSEC. So if we are using that acronym as well, CSEC is commercial sexual exploitation of children. And so we broadly included any sort of exchange for money, goods, or other favors. In the Brazil context, this can be things like cell phones or rides to parties or access to parties more broadly, as well as social protection, anything where there's some sort of tangible exchange happening. And then we also limited our study to girl children. Something of note for the Brazil context as well is that sex work is legal for people over the age of 18 in Brazil, and the age of consent for sex in Brazil is 14. And so for children between the ages of 14 and 18, it is the act of exchange that makes this a crime and makes it a form of human trafficking under Brazilian law. But there's kind of a gray area where the sex itself is not the thing that is illegal, it's the exchange. And so that was one of the key challenges with this research and with this population is kind of managing that gray area. Our study was performed in northeastern Brazil in the Recife metropolitan area where there are about 4 million people. The poverty rate is quite a bit higher than the Brazilian average. So at about 10.5% of people are living in extreme poverty. And speaking to the relationship between the legal cutoff for sexual consent and for consent to participate in sex work, almost 2/3 of adult women who are engaged in commercial sex started as minors. And so, as Dr. Okech mentioned at the beginning, our study, by definition, any of the children in our population are victims of human trafficking because they were minors engaged in C-sex. So we did not necessarily consider the thresholds as cutoffs for whether or not individuals in our population were victims of trafficking, because they definitionally were, because they were children at the time of their victimization. Next slide, please, and I will pass to my colleague, Carl.
Thank you, Elizabeth. A great introduction. I'm going to try to start my video. And there it goes. Okay, so we applied two methods. The first method was respondent-driven sampling. And as Elizabeth implied, we had a difficulty contacting directly young girls who were engaged in commercial sex, and for reasons that had to do with the police laws and regulations in Brazil and had to do with ethical review committees, we could not interview them directly. So we interviewed women who had experienced C-sex while they were a minor, but were currently 18 to 21 years of age and working in commercial sex. So that was one sample. And that study was not just to determine prevalence, but also provided us a lot of program relevant information that Elizabeth will come back to. The second method we applied was network scale-up. That was done with a sample recruited through random digit dialing, and therefore was a very brief survey that did not provide us any additional information beyond membership or non-membership. Although there's been quite a lot of positive press about PPS so far in this meeting, in this particular case, as are many random digit dialing samples, these results are biased. Most of our participants were men, and we had to go through many calls before we recruited the sample. So there's bias built in, even though it can be classified as PPS. Okay, next slide, please. So when we look at some of the information that we collected around the interview in the RDS component, as Elizabeth mentioned, 100% of the participants exchanged sex or other sexual acts for money, were trafficked, were considered CSEC. 80% were still enrolled in school when they began, which opened up opportunities for thinking about interventions. 22.4% were under 15 years old when they experienced CSEC. And 58.4% were approached by someone they knew when that began. 45.9% received about $20 or less the first time they experienced CSEC. $20 is a lot of money. I calculated the hourly wage based on Brazil's minimum salary. The hourly wage given that minimum salary is about 98 cents US per hour. So that's quite a lot of money. When asked why they were engaged in CSEC, most mentioned economic pressure. Some of them mentioned wanting to purchase certain kinds of consumer goods, either foods or other products. 37.1% said maintain basic needs. 24.4% said that they were influenced, and that could be by friends or family, or in the more rare case, forced to participate in CSEC, although that did happen. About 15% mentioned pregnancy, either because they had become pregnant, had a previous pregnancy, but that drove them to consider some form of income and drove them into CSEC. About 10% mentioned that they had been abandoned by other members of their family, and that was mostly nuclear family. Sometimes they went to more distant relatives, but there were issues of abandonment that drove them into CSEC. In terms of their backgrounds and the context, this is not just while they were engaged in CSEC. If they had ever experienced emotional abuse, 54% said yes. 31% they had experienced physical violence. 25% said that they were unable to refuse work once they had begun working in CSEC. 4.5% mentioned police violence. That meant that in their venue where they were working, be that a hotel or a bar, they had witnessed police there being violent with participants in that venue. 17.4% mentioned drug dependency, 11% alcohol dependency. We collected some qualitative information, some interviews, and here are two quotes about these factors that influence participation in CSEC. My grandmother was responsible for me because she was elderly. I told her I would help her. At 16, 17, there was no other way for me to earn, no one to help us, so I entered this life and the construction of a career. My family was threatening to throw me out of the house. I would go without eating. I thought I'll try commercial sex at least one time to see if it's any good. I was 13, and the sex was with a friend. Another tragic instance. In terms of the prevalence that we identified, network scale-up gave us a lower median of 19,700 than the RDS. That median, 19,700, was used as a prior in terms of calculating population size with the population size estimator in the successive sampling estimator. But if you look at the true range, what's happening here is both through NSUM and through RDS, you're actually selecting a range of results, right? So yes, we identified a median, we report them, but the value could be between 10,000 and 40,000 for NSUM and between 12,000 and 44,000 in RDS. And by those criteria, these are very similar results to come out of these two very different methods. If we accept the 22,000 median figure, then that constitutes, given the census in Brazil, which is another complicated topic that we don't really have time for here, that's about 16.7% of young women in the Recife metropolitan area, age 18 to 21 at the time of the study. So that sometimes raises eyebrows in audiences, and we provide some context in terms of UN figures for Europe that say that value for underage sex work in Europe is about 10%. Okay, next. And I'll turn this back over to Elizabeth.
Okay, thank you, Carl. So in summary, for our study, CSEC thrives within a system of economic vulnerability and social norms and domestic violence that lead to a fairly globally relatively early sexual initiation for girls. The context of CSEC is enabled often by parents or school staff or structures where there's simply just not enough structure to provide for children or protect them from harm in either setting. We also found that, notably, that many, I believe it was most of the girls, were still enrolled in school at the time that they began CSEC, that they historically had reported beginning CSEC, meaning that school may be a very important venue, both for the transmission of information about how to become involved in CSEC, as well as an opportunity for education about the prevention or harm reduction associated with CSEC. There are also clear gaps in the government's ability to enforce the law or to discourage or punish offenders. So our recommendation is very much a holistic and systemic approach to address the underlying factors that cause and perpetuate CSEC. I know I'm running out of time, so we've included a few recommendations both for the government of Brazil as well as civil society organizations. One of the things coming out of this study that we have conducted is a push to review the national, state, and municipal level policies and plans that protect children from CSEC. The recently elected Lula government in Brazil has committed, at least in theory, to a whole of government response, both at the national and then state levels. And then we also work with civil society as the Freedom Fund, and our recommendations are to include or to expand CSEC prevention in schools, community programs, et cetera, and then creating safe spaces where children can disclose harmful incidents and work towards recovery from CSEC victimization. And we'll go ahead and jump to the last slide very quickly. These are just some photos from some of our initial dissemination of the research. So we've had one event with the research community in Brazil, as well as the community of practice, and civil society actors invested in ending CSEC, as well as I mentioned, the administration under the current president Lula has stated that they are committed to the cause of ending CSEC in Brazil. And I'm sure we are out of time, so thank you for that. I'll pass back over to Lydia.
Thank you so much, Dr. Anderson and Dr. Kendall. Up next, we have NORC at the University of Chicago, and presenting will be Riddhi Sahai and Dr. Katrina Cole. And thank you so much. I know that's a lot of information to pack into a very short amount of time, so I appreciate all of these very brief presentations. Over to you, Riddhi.
Thank you, Lydia. Hi, everyone. My name is Riddhi Sahai, and I'm a senior associate at NORC. and the project manager for the Morocco study. I'm joined by my colleague, Katrina Cole, and we will be presenting key findings in terms of prevalence estimates and programming and policy learnings and applications. So NORC implemented the study in collaboration with UMass and our local data collection partner, Clear Vision Consulting. In addition to Katrina and I, we also have other team members here with us today, Kyle Vincent and Clifford Sinas. Next slide, please. Okay, so Morocco has a history of both domestic and migrant trafficking. And despite this, prior to 2016, there was no legislation on trafficking specifically, and it was legally classified as kidnapping. So the 2016 law on trafficking in human beings created a legal framework for trafficking in people and improved protections for children and adults who were vulnerable to trafficking. More recently, in 2021, the government introduced new legislation, making it illegal for people under 16 years of age from engaging in domestic work. And so 16 and 17-year-old individuals are permitted to engage in domestic work with the consent of their parent or guardians. Funded by the PRIF program, this study applied two strategies to study and estimate the prevalence of domestic servitude in Casablanca, Morocco. The first one was the mark recapture experimentation, or the MR method, and the second was the Vincent link tracing sampling, or the VLTS method, which we'll explain in more detail in subsequent slides. The primary goal of the study was to compare these two estimation strategies in producing prevalence estimates on forced labor among domestic workers. Next slide. So in the study, we evaluated two strategies which are commonly used to study hard-to-reach populations. The first one was the mark recapture sampling or experimentation, and the second one was the VLTS, or the Vincent link tracing sampling method. So VLTS is essentially a variation of the traditional respondent-driven sampling method, a method that's been used in several other studies under the PRIF consortium, and it involves multiple and widespread entry points through a larger initial seed or domestic worker sample. There's a systematic recruitment procedure, and it also incorporates referrals from domestic workers, but that is limited to only 2 or 3 rounds of referrals. We also included a randomized controlled trial to assess the impact of survey modalities, so face-to-face versus cell phone-based modalities of conducting these surveys. And we looked at the impact of these different modalities on the prevalence estimates that we had. This was, of course, embedded in the VLTS component of our study. So our local data collection partner, Clear Vision, had extensive experience collecting data from vulnerable populations and leveraged their experience for the study. We focused on 2 key urban receiving areas of Anfa and El Marif in Casablanca. And the study was split in 2 phases. First was a formative assessment that included piloting our field procedures, recruitment of domestic workers to participate in the study, as well as testing out our survey instruments. And that was done in November and December last year. We then took those learnings from the formative assessment and prepared for the second phase, which was main data collection. And that went on for an 8-week period from Jan to March 2023. Next slide. And so just to tell you a little bit more about each of the methods that we use. So the mark recapture, also known as the capture recapture method, it's a well-established strategy for estimating the size of hard-to-reach rare and elusive populations. It's gained a lot of attention among researchers who study stigmatized populations specifically. And so this was one of the methods that we used. We also included an NSUM component within our mark recapture experimentation, and a full design of this NSUM component was beyond the scope of the study. And so as a compromise, we included a very minimal set of questions to identify the number of acquaintances of the respondent according to several personal characteristics. Next slide, please. And in terms of the VLTS method, as I mentioned, the VLTS is a variation of the respondent-driven sampling or RDS method. So to mitigate limitations with conventional RDS, such as seed dependence, any bottleneck issues, we incorporated this new and revised sampling strategy. And the essential goal of the strategy is to achieve a sample with wide entry points so that the features of the sample sort of approximate recruitment within a random sample and approximates the strategy that would be there for a random sample itself. Again, we used a systematic recruitment procedure, for which we actually use the different venues that were captured at the mark recapture method stage, and again, strategically chose access points to identify domestic workers through local organization contacts as well. Next slide, please. And quickly going over some of the key findings for both of these different strategies. So for the MR data collection procedure, we reached a final sample of 1,067 captures across 1,038 unique individuals. We used, the 2 operational thresholds that have been discussed, and that's been consistent across the different studies under the consortium. And so for prevalence estimation, any respondents who met either threshold were considered potential victims of trafficking. As a reminder, threshold 1 is essentially includes 2 indicators: performing any sexual acts or paying off debt or receiving wages. The second aspect is, of course, losing freedom of movement of any kind. Threshold 2, on the other hand, is made up of a larger set of indicators. So it's 10 indicators that fall into several categories of abuses, anything related to employment practices and penalties, personal life. And so respondents who reported experiencing at least 2 or more of the 10 indicators under threshold 2 were considered potential victims. The MR strategy estimated that 27.7% of the sample, or 28.73% of the domestic worker population could qualify as victims of forced labor when both threshold 1 and threshold 2 were combined. And for threshold 1, you'll see that the numbers are slightly lower. So only 14% of the sample would be considered victims of forced labor. We applied several estimation strategies for estimating the domestic worker population size in these 2 municipalities of Anfa and Marif. And so that's been represented here as well. And it's also detailed in the report that will be shared publicly soon. Next slide. On the VLTS method, we found that the data collection procedure reached a final sample of 989. The estimates for these were much higher. And to give you a sense of how these estimates compare with the with the mark recapture findings, I'll hand things over to Katrina so she can talk a little bit about the comparison between the different estimates. Katrina, over to you.
Thank you, Reedy. My camera is not working today, so my camera's not working, so please enjoy this outdated photo of me or my black screen. But anyway, so if we could go to the next slide, since we have 2 more presentations, I will kind of hurry through this. But generally, we found that both estimation strategies detected sizable rates of trafficking violations. We did find that the VLTS strategy produced a smaller estimated population size, but higher rates of labor violations. Then the mark recapture generated a much larger population size, which was either around 9,000 to 19,000, depending on the specific estimation procedure used, but lower rates of forced labor violations. But in some, we generally found that these violations were fairly common among domestic workers in these 2 municipalities in Casablanca. Let's go to the next slide. So as mentioned, there was an RCT embedded whereby all referrals beyond the seed were randomized into one of 3 interview modalities, either face-to-face, mobile phone, or their choice of those 2. And the goal was to test if any of these interview modalities would produce varying results. Next slide, please. And what we found from this was that the 3 randomized assignments made no differences statistically or substantively in the prevalence rates of forced labor that we found, which you can see in the table that there is no significant difference. So we observed the same patterns on nearly all constituent items under the main threshold indicators. Next slide. Oh, thank you. Okay, so we initially attempted to compare TLS and VLTS, but during pilot testing, we observed really low response rates at the primary TLS venues that basically made this not a feasible option for this. And that's why we switched to apply a MARC recapture procedure instead. We also initially planned to focus on child domestic workers, but as was mentioned a bit earlier, there were some legal changes in Morocco before we started. So they made child domestic work illegal, and this made it almost impossible to find child domestic workers. So these restrictions prevented us from reaching this population, which is why we switched to focus on adults. Next slide. So some limitations. Our data collection was limited to open space recruitment. So none of our methods were able to reach victims who are either entirely isolated or prevented from interacting with the outside world if they are really forced to stay in the home where they are working. We also included an NSIM component with a minimal set of questions, but as it was designed, it was inadequate, to say that. And we also found that our NSIM estimates were largely discrepant from what we found with the corresponding MR and VLTS estimates, but with more uncertainty. Also, the network sizes that were reported, a lot of them were less than 3, which limited the benefit of using this procedure. And our last slide. As mentioned, our initial approach of doing TLS was problematic. The cost of surveying and canvassing the 2 municipalities to collect all potential survey sites was a really expensive undertaking. The frequency of venue attendance questions are time-consuming and burdensome for respondents, and it requires a heavy concentration of the population in a relatively small area. So this was just not a great option for this population here. And then thank you. I'll round that out there.
Thank you so much, Katrina. So we've heard from 5 of the research teams. We have 2 more presentations to go. Up next, please welcome back Dr. Meredith Dank with the presentation on Costa Rica. You've already heard about Tanzania. Now, please welcome back Dr. Dank.
Hello again. I know we're short on time, so there are certain slides that I've already covered, other folks have covered, so I'll skip through some of them. But before we begin, I just want to thank, it's essentially the same cast of characters, but instead of Comheswa, we worked with fabulous IOM in Costa Rica. And I believe one of my colleagues is tuning in, Alina Cedeno. So yes, we can continue on from here. So a little bit about, the background and context. I think a lot of folks on this call probably have heard a lot about forced labor in the fishing industry in Thailand and in other parts of Southeast Asia, but you might be scratching your head and wondering how if there's forced labor in the fishing industry in Costa Rica. Very little to no research has been done prior to this. But the fishing sector is essential for the Costa Rica economy. The last count, which definitely had a lot of issues and seems like some sort of undercount of the number of people working in the fishing industry in Costa Rica, was around 20,000. And our study in particular focuses on one state within there, Punta Arenas, which is on the Pacific coast. So next slide. If you want to just click on it again, there'll be a map that shows up. Thank you very much. So again, our study population focused on individuals 18 years and older who were engaged in some facet of the fishing industry in Punta Arenas in Costa Rica. So that includes people actually fishing, those who are peeling shrimp, packing ice for the shrimp, for the fish, etc. And you could see that activities took place in various cantons in the state of Punta Arenas, which is in light yellow towards the bottom left. Next slide. So we use the same methodologies as we did in the Tanzania study, although in this one, we did not have to switch to STSRS. We were able to keep the multi-stage probability proportionate to size sampling, PPS, because unlike returned domestic workers, those working in the fishing industry in Punta Arenas tend to not move around a lot. It's oftentimes generational families, generations within families that work in the fishing industry, and they tend to stay put. So the sampling began with a roster of all districts from the government population data for the selected regions. IOM did a great job in identifying where the fishing communities are located within Punta Arenas, and you can see the different places where we sampled from within that state. And we sampled more houses in more densely populated areas and less in less densely populated areas. And in all, we did complete a total of 80 surveys per community, with the exception of 1 or 2 communities that were larger. We oversampled within those communities. Next slide. And unlike the networks that we saw with the Tanzania study, as I had mentioned, the fishing communities are definitely tighter knit, again, often comprised of multi-generations of families involved. So you could see the clusters within this graph. They are very well networked and very connected to one another. So we didn't need as many seeds as we did in Tanzania, but we did use the Wiltz method. So we used more seeds than we would have using the traditional RDS, and we used 98 seeds. Next slide. So what we found with the PPS methodology was a large population of, within just the state of Punta Arenas, around 26,000 folks working within the fishing industry with a very large confidence interval. And then with the Wiltz method, we found much less, around 8,000, with a smaller confidence interval. But if you look at the lower bound of the PPS and what is the average of the LTS, it's around the same. So if we were to say that on average, there's about 8,000 people working in the fishing industry in Punta Arenas. Next slide. I will not go over this again, but we use the same threshold determination. Thank you. Within the final sample of the PPS, so we surveyed over 1,000 individuals and over 1,000 households. The overall rate of forced labor was 21%, about 10% met threshold 1, and 19% met threshold 2. Next slide. And with the Wiltz method, we surveyed approximately around the same number of people, a little over 1,000, and found very similar rates of forced labor at 22.4%, and 7% met threshold 1, and about 21% met threshold 2. Next slide. So when we look at the demographic profiles between the two methodologies, the sample for the PPS was about 32% female and 67% male. Almost all the individuals were currently married, whereas 32%, about a third, had never been married. A little less than half were not able to cover their household bills over the last 6 months. And about 5% of the sample were not Costa Rican. So just a little bit about that is that within the fishing industry, and I'm not necessarily talking about long haul fishing, but more of the artisanal and medium sized fishing, you know, a lot of Costa Rican, as I said, it's a family industry. So it is comprised of a lot of Costa Ricans. That said, you know, we anecdotally heard about other individuals from other parts of Central America working in the fishing industry. And as you can see, the biggest difference between the demographic profile with the PPS and the LTS is that with the LTS, the VILTs, we were able to survey about 12% of individuals who are of non-Costa Rican descent, which I think it really speaks to the idea of going within networks and going deeper within networks to get at more hidden parts of the population. Next slide. So the employment characteristics, around 65% began working in the fishing industry before the age of 18. Just a little flag there that maybe some folks around thinking about child labor, their red flag is going off. We didn't obviously focus on individuals under the age of 18 at the point of part of the survey, but this does warrant potentially some future research to see what the nature of the work that those under the age of 18 are doing in the fishing industry. Over 75% of those did not receive the EMAS benefit, which is technically supposed to be provided to those who are under the poverty thresholds. As far as the Incopesca license, so that is the actual fishing license that allows you to go and fish. The fishing industry is highly regulated in Costa Rica. That said, a large percentage of those who took part in the survey said they do not have an Incopesca license to fish. And then looking at the types of exploitation and abuse that they're experiencing, 30% of them said that their employer had reduced the value of goods or services they provided. And then about 10% said they had a debt that they did not agree imposed on them by their current employer. What is typically happening is they're getting overcharged for renting the fishing vessel and for the gasoline that they need to be able to fish. And then the fish that they're selling, they're being basically the buyers are underselling, and then they're selling the fish at a much higher profit. Next slide. About 80 to 89% of the respondents reported staying at the job with abusive conditions because they do not have better job options, and they worried about wage loss. And for those who report experiencing abuses in the workplace, about 20 to 29% said that they did seek help. Next slide. So comparing the methodologies, I will say the VILTS methodology was a lot more expensive for this project compared to the PPS, although the VILTS methodology was able to get at more hidden parts of the population. Next slide. Some of the challenges and limitations is we did limit it to Punta Arenas, so we cannot extrapolate and say that this is, what forced labor in the fishing industry looks for all of Costa Rica. There were a few non-Costa Rican fishermen captured in either sampling method. Certain groups, even though they might be the most vulnerable, were not necessarily able to be reached, particularly when it looks at the gender breakdown. I think we were able to get very few trans folks, even though anecdotally we know that they are also working in the fishing industry. And we used some really great GIS mapping to be able to really determine the size of the different fishing communities and where we should focus our efforts when it came to sampling. Next slide. We also received some intervention funding, which we're very excited about. A lot of that funding is going to focus on awareness campaigns because again, not many people realize forced labor is happening within the fishing industry in Costa Rica. So really trying to boost the knowledge of labor's legal protections and referral pathways, and also create alliances with key counterparts from all political sides. IOM has already done a launch of the final report for the prevalence study, which included a lot of different government agencies and leadership, including the U.S. Embassy and the ambassador took part in it to help spread awareness around this issue. Next slide. So again, we're really going to be focusing on capacity building, identification, and safe referral of victims of trafficking with a community-based approach. Capacity building of local authorities. There will be a huge training done with the Coast Guard to make sure that they know how to identify and how to refer potential victims of trafficking. Establishment of local task forces. So Costa Rica has a Costa Rican-wide task force, but really honing in on those fishing communities and developing local task forces to address this issue. And again, a lot of awareness raising that will be happening within the communities themselves. And I will end there. Thank you.
Thank you so much, Dr. Dank. Well, last but not least, we have Stanford University and Dr. Kim Babiars. Over to you, Dr. Babiars.
Hi, everyone. Can you see my video and hear my audio?
Yes.
Okay, great. So thanks very much, everyone, for hanging with us today. We are the last to present and also the last to finish. I'm Kim Babiars. I'm an economist at Stanford Health Policy and one of the co-founders of the Stanford Human Trafficking Data Lab. And I just want to send a lot of thanks to my colleagues at the Data Lab. Jesse Brunner, I think, is here with us this morning. I think Grant Miller might also be here and several other members. And I want to also thank our local collaborator, Luis Assis, and also Science, who is our organization that helped us with data collection. Okay, next slide. So our study focused on labor trafficking in Brazilian agriculture. We selected this sector because formative research suggested that agriculture accounts for by far the most cases of trafficking that have been known in Brazil in the past. It's an enormous sector of the economy, millions of people involved in agriculture, and quite a lot of trafficking. It's thought that agricultural workers are vulnerable to trafficking because a lot of times this work is carried out in very isolated, remote locations. The working conditions are quite difficult and often exposed to lots of harmful chemicals or harmful substances in the process of agriculture. There's almost a complete lack of formal contracts in this industry, and the workforce is often made up of temporary workers, migrant workers, very vulnerable to exploitation. The qualitative evidence that we gathered before we undertook this study suggested that the most common means of trafficking were through indebtedness to their employers or their recruiters, wage theft rampant in this industry, and fraud, like, for example, undercounting the production of the workers, and sort of underpaying in that way, or overcharging for food and housing on site, that kind of thing. Isolation, control over documents, degrading and unsafe living conditions is extremely common, and also inhumane working conditions as well. Okay, next slide. So one of the challenges, although we knew that there's quite a lot of trafficking in this enormous sector of the Brazilian economy, there, of course, was not, we're relying on the cases that have been known, which means the cases that were detected by law enforcement. And there's, virtually no unbiased data to tell us more about exactly how widespread is this, how prevalent is this in sort of a representative way, and also what are the dynamics of trafficking in Brazilian agriculture. So the first method we use to understand labor trafficking here, and actually I'll just preface one more point here, is when I'm saying Brazilian agriculture, we mean that extremely inclusively. So we mean, sort of regular traditional agricultural crops. We included specifically fishing as well, also cattle ranching, and everything to do with, livestock raising. And also including forestry and like producing crops from managed forests, as well as deforestation activities as well. So it's an enormous industry, and we considered it expansively. And our target our target population is the entire industry, including people who are working, on family farms as well. So the first method we used was a population representative household survey, and this was very much modeled on sort of these well-established demographic health surveys that have been carried out for many, many years in many, many countries, where we're visiting households, interviewing people who live in those households about their experiences through work history modules. So we're talking to them about what kind, first establishing, are there agricultural workers living in this household? If there are, then we ask them detailed work history modules about their experiences in each of the agricultural jobs that they have worked in the past 2 years. We targeted a sample size of 7,000 individuals in our survey. And those individuals were spread out across 210 study clusters, sampled weighting according to the relative proportion of the population engaged in agriculture. And we focused on 4 primarily agricultural states in Brazil. We used our second method, which was network scale up and some. At the same time, we did the PPS survey. So we used the same underlying sample population, and we used the same, and some was carried out during the same household visits as the PPS survey. The way that we did this is a subset of the sampled households were also then passed into an NSUM module, which was asked after the PPS survey. We targeted a sample size of 700 individuals for this. And finally, one additional feature that we included, because we did NSUM after the PPS sample, we were able to make a real-time determination about who met the qualification for trafficking according to their work history responses. And those people that were determined to have been trafficked in their previous jobs were also then passed into what we're calling a generalized NSUM module, which really focused on asking questions about how much did they talk about those experiences within their network. And the goal of that was to really start to understand transmission of information across networks of agricultural workers. So how much do workers share information with each other, and what is the visibility of trafficking within that network? And that can help us to get to better, more accurate NSUM estimates in the end. Okay, next slide, please. We also did a third method where we looked at a complete universe of all of the known cases, and so that we can start to understand, compare those two different sources of information and start to understand the biases inherent in working with administrative records. But I don't have time to talk about that today, so let's move to the next slide. Okay. So as I mentioned, we are the last to present and also the last to finish our data collection, and it is not even finished yet. So we are currently on track to finish data collection at the end of this week, which is quite exciting after a very long process. So the results I'm going to present to you today are extremely preliminary, and they're based on all of the data that was collected to date as of November 15th, so right before the holiday here in the US. At that point, data collection had closed in 180 of 210 study clusters. In those clusters, we had listed a total of over 45,000 households, and we identified and sampled workers from 8,814 households. We ultimately made the decision to actually sample more households than planned because we found that a larger share of workers than we expected were engaged in family business, family farms, family agriculture, as opposed to like temporary agricultural workers in on somebody else's farm. And the NSUM module at that point had been administered to 687 workers. Okay, next slide, please. Very preliminary results show that when we scale our results to the entire ag sector, so we're asking questions among these people, but then also including everybody even that's working on their own family farms, we find that 6.7 per thousand agricultural workers meet the definition of threshold 1, which is the most strict definition of trafficking. And 27.7 agricultural workers per thousand meet threshold 2. We also computed the sort of soft threshold 3, which David mentioned before, and I think some other of the teams also estimated. That produced quite high estimates of 73 per thousand, 73.5 per thousand workers meeting threshold 3. And that's kind of the loosest, most soft definition of trafficking that we considered. And then if I didn't put these results in the slide, but if we restrict our analysis to people who are temporary workers, so workers and workers who are not working for their family farms, the results are quite a bit higher, substantially so. And they're on the order of 6 or 7% of temporary agricultural workers not working on family farms meet threshold 2 trafficking definition. Very preliminary NSUM estimates largely agree with threshold 2 estimates from the PPS sample. We find about 26 per thousand workers in the NSUM module are meeting threshold 2 definition of trafficking. So very consistent. However, I'm going to put a lot of asterisks on these estimates because we do not have final sample weights yet. Our survey teams are still in the field. And also, in particular for the end sum estimate, we have a number of adjustments to make. And actually, this is a methodological point that I'm sure others have encountered as well, but I think is really important to this discussion of how to estimate prevalence. You know, trafficking is a multi-indicator state, and so it's not enough to know how many, people who gave birth 12 months ago or within the last 12 months, had their wages stolen by their employer, and how many women who gave birth 12 months ago also had violence from their employer. You have to know that those are actually the same people, and actually that those two things happened in the same job at the same time. They're concurrent. So we have an adjustment that we're going to make to try to account for that. And then, of course, we need to adjust for the visibility of trafficking within agricultural networks. So those are all coming as soon as we finish data collection. Okay, next slide. I'm going to skip over this because not only is it preliminary, but we only have 1 minute left. So I'm going to skip over this to talk a little bit more to the next slide, please, about policy implications. Next slide. Okay. So the policy implications that we are already seeing from our data collection, even though it's preliminary, is that it's really important to engage worker and farm owner outreach, focusing on several key points of vulnerability. One of them being the benefits of formal contracts and potentially also decoupling contracts from social benefit administration. There's a lot of hesitance to have a formal contract with your employer because it can affect the social benefit, the safety net benefits that workers receive. And so decoupling those might help protect workers better, help them have more established contracts. Knowledge about workers' rights, for example, the right to having pay earned to date, withholding pay until the end of a job spell and using that pay to hold workers in their job without allowing them to leave is a very common form of trafficking that we found in our survey. And of course, options for legal recourse and reporting. Another super beneficial program that is emerging from our data is basic numeracy and literacy for workers. So helping them to understand and how to calculate the pay that they are actually owed, accounting for expenditures and deductions, and then avoiding common methods of fraud, like undercounting the production that they've done. Okay, so next slide, please. We have some really important points to bring up about some of the challenges, and some of the other panelists have mentioned some of these as well. One that I would like to raise with this group, of course, is the lack of clear ethical guidelines and best practices when interviewing people who are potentially trafficking survivors. And that would help a lot with regulatory environments and ethical review boards. And also just kind of knowing how to be an ethical research in the space of human trafficking when you are potentially encountering people who are victims of crimes in contexts where there are highly heterogeneous legal options for them. Would like to emphasize the clear importance of long-term data collection and a common framework for data accumulation. So I really applaud the efforts of this body here and all of the others who are currently working to implement a common structure for estimating the prevalence of trafficking and how to collect data on that, because it's going to be tremendously useful going forward as we can incorporate that data collection into ongoing regular labor surveys and administrative data accumulation. And then I also want to raise a few challenges that have arisen in our particular context of the agricultural sector that maybe apply in the fishing sector as well and some other sectors, but not all sectors for sure. One of those is how to think about trafficking indicators in the context of those employed by family members or working on family farms. Our target population frame is the entire agricultural sector. That includes people who are engaged in agriculture for relatives or for themselves or whatever. But it's really unclear how to apply the trafficking indicators in that context, and the questions may need to be different or revised for those individuals. The other points I want to make are the differences between temporary and permanent workers. This is really important for understanding trafficking because conditions may change over time. If you're in a job for 2 years, you may meet the trafficking conditions for 1 year and not the second year. So what does that mean for people who are victims of trafficking? Are they always a victim of trafficking? Is that job considered a trafficking job or not? The other point is that sometimes workers may comply with some of the indicators. So this was really clear in like having formal contract, for example. Workers did not want those, and for other reasons. And so how do we think about those? And then finally, many of the indicators of trafficking might not be realized until a work spell has ended. So how do we think about workers who are still working in a given job spell, if they don't actually know how much they're going to wind up being paid at the end, if they don't realize they're going to be cheated until the end of the job? So how do we actually survey those individuals and measure trafficking among those? So those are challenges I'd like to throw out to the group. And I believe that we are 3 minutes over time. So I'm going to end here and hope that we can go over for some questions.
Thank you so much, Dr. Babiars. Yeah, we have finished all of our presentations. As you just mentioned, indeed, we have run out of time, so we don't have time for Q&A, but I did want to thank our panelists, our presenters, for answering the questions in writing during their presentations. We'll also be sharing those questions and responses with all of the attendees. So if there are any still any questions that were left unanswered, we'll be sure to respond to those when we send out an email to all of the attendees. I want to be mindful of everyone's time, so I'm going to pass it over to Dr. Okech for some closing remarks. And thank you so much for being with us for 2.5 hours.
Okay, thank you, Lydia, so much. Great. So thank you, Lydia, and mine will be very, very short. I know people are in different parts of the world, so it's going to midnight maybe for some people. So again, I want to reiterate how grateful we are for the research teams, the local collaborators, and even the agencies that help them do the work. So we are so grateful for the work that has been done, and we're looking forward actually to building on this. As a matter of fact, the presentation by Stanford actually had many things that we spoke that I spoke about in terms of improving the use and application of our indicators. So we have more exciting stuff coming up for you. Time was short, so people were only presenting for like 10 minutes, but moving forward, we are going to have the teams present interesting learning series. So as you can see on the screen, the first team to do that is going to be the team from Tunisia, which is going to present on December 4th, 2023, this year, and from 10 to 11 a.m. Eastern. So to register, you can scan the QR code now, or visit that website that you have there. We'll also send this to your emails. So we're looking forward. So these are 1 hour series, a little bit more detail, and also application to those countries. And our second learning series is going to be on December 19th from 1 to 2 p.m. US Eastern Time, and that will be by the Freedom Fund of their work in Brazil. Again, thank you so much. Have a great day. Happy holidays, and we'll be in touch as we improve the prevalence of human trafficking research. Thank you so much, and bye-bye.